So the kids just have to give back 1 year of their money that they need. So some people buy it as a cushion. But see, you're talking about people who have a lot of money. I mean, you have to have $600,000-$700,000 to protect and be paying the premium on this policy many years to do this. And there are things called partnership policies. The long-term care policy. That's where you pay this big premium and you get coverage that covers 3 years of nursing home care or 6 years of home care. And at the end of the policy, you can go on Medicaid with no asset requirement. That's for people who have a lot of money. Okay? So you can look into that too. It's a hybrid. Okay? But these are the people who do these mixes of Medicaid and long-term care are people who have millions of dollars, who still want to save money and want to try to eke out whatever they can for their family. Yeah.
Just to also let you know, I have experience with Penn Tree, which is a long-term care insurance policy that I've had 20 years or so, that they tried to go bankrupt.
Well, that's always a worry too. That the company you've been dealing with all these years goes under, but not supposed to.
Stop them.
That is a trend. We took out a policy 40 years ago because we really wanted to come in there. The price was $100. Now it doesn't really go up as opposed to.
Well, if you bought, you could buy inflation protection. You did. Well, I have had some people who've come to me and they go, Mom bought this policy 3-4 years ago, we're paying this premium. And then when we analyze what's going to pay out, they go, I'm just dropping it. I'm just going to drop it and forget about it and we'll go on Medicaid now. Because we're paying this amount, and now I realize what the payout would be per day, and it's so tiny, and paying this premium over, I'm just going to, it's a wash, right? And close it down. Sometimes it happens, I've seen that.
You probably covered this, but if your Social Security means that your income is over $14,000 a year...
No. You don't mix income and assets.
Oh, sorry.
No, you mix the income and assets.
Oh, all right.
People always do that.
Okay.
Income is what you got sitting in the bank now.
Yeah.
Income is what's coming in the first of each month. So you have $14,000. Yeah, you can't let it accumulate. I mean, you're keeping $800. You're keeping $800 a month pocket money, but if some people don't even spend that, so they keep putting it in the bank, and I go... Sometimes people come to me at recertification when they turn to me, at the end of 1 year, and I look at their bank books and they go, I said, the last 3 months, you've had $20,000 in the bank. They go, well, no, I've been saving money. I said, it's your job. You've got to get rid of the money every year. You can't go above $14,400 because you were ineligible for those months you had more than $14,000 in the bank.
But what does Medicaid care about income?
Well, that's what we talked about, the pool income trust. They want you to give them the income every month.
Oh, okay.
But we're going to hopefully shelter it in an income trust.
Well, if all nursing homes accept Medicaid, what determines what nursing home you go to? They decide
bed availability.
They won't take you.
No. It's against federal law. They can't discriminate between. Like I say, if you're applying and you have Medicaid, you're in the hospital, and you're applying and you have $1 million in the bank, they're not allowed to discriminate between either of you. The first on the line gets in the first in the bed. But the biggest issue is bed availability. It's when the family comes to me and say, well, we're going to start applying for nursing homes for my mom, I say, it's like applying to college.
Yeah.
Your first choice, second choice, third choice. Then you need to do PRI, which is the SAT score, and you're going to submit it to each one. And then they may say, okay, you are financially eligible, your PRI score, which is your ability to do things, score is fine, but we have no beds. I mean, a nursing home, unfortunately, you're waiting for someone to pass away.
Then you get on a waiting list.
So you get a waiting list. And you may say, well, the one I want, I'm on a waiting list. But they have a bed in Staten Island. Right? Not to say there's a bed in Staten Island, but, I live in wherever, in Queens, and I go all the way over there. So it's bed availability.
So then there's a rating system for nursing homes?
Rating?
Yeah.
Well, you said PRI.
PRI is a physical examination about what you can do and not do. you have to score high enough to be admitted to a nursing home. You can't go into a nursing home and be healthy. And I mean, people think that, oh, if I'm going to write a check to them, they'll take me. No, you have to be ill enough to get in. And sometimes we have, unfortunately, Alzheimer's patients who, mentally not there, physically fine. Very hard to get Medicaid home care for that person because you're asking for a babysitter. And Medicaid is not there for safety monitoring. You have to have tasks and things you have to have physically done for you. You can't just say, Mom's fine, she just sits there and watches TV all day. If you need someone in the house, so she doesn't burn the house down or wander away, Medicaid will not put a worker in for that. They have to be there for cooking, cleaning, toileting, bathing, whatever. Yeah.
I heard recently that your whole life insurance policy could be used to pay for long-term care. Is that something new? Is that like reverse mortgage?
There are a lot of different things out there that people are doing now. Okay, what you're talking about, I was going to do this with one person I have. There are these companies that will buy life insurance policies. So you say, okay, I have a life insurance policy, $100,000, $200,000. And, it'll pay when I die, but I need money. So they'll say, okay, it's a $100,000 death benefit, we'll give you $40,000 for it. You name us the beneficiary, we'll give you the money. So I'm sure that's something like that, and that money can go for long-term care, something like that.
So you've heard of that?
There's always someone out there who's going to,
And one of the questions, if you're the sponsor of a 529 plan, is that considered asset?
You're the sponsor of a 529?
No, college plan.
Oh, college plan. Okay, no. College money. You've been putting aside money in a 529 plan or you have an in-trust for a candidate. That's your money.
So that's counted as
That's counted for Medicaid. Because if you say, oh, I'm destitute, but I have $50,000 in a 529 college plan for my grandson or my son, you could break it. There's no limitation. Now, there may be a penalty, but Medicaid doesn't care. If you can get hold of the money, even with a penalty, Medicaid counts it. Like some people say to me, well, Mom has all this stock, but it's way down. And if we sell it, or the CD, okay, good example. CD is not mature until 2015. If you go break it today, because you need to go on Medicaid, you're going to pay a penalty, right? Medicaid says, no, you got to break it. You got to pay a penalty. Okay, so you're not going to net out the $10,000 that's in there. You get a penalty, and the penalty is not as big as you think. But you have to pay the penalty and get it out and spend it on your home care or nursing home care if it's there. Okay, so the rule is if you can get it, okay, even with a penalty, you have to get it and it's counted for Medicaid.
You mentioned in the application that among the documents that you have to bring, you included proof of citizenship.
Right, you
have to be an
green
American
card
citizen.
or legal. You have to be legally here.
Okay. Oh, okay.
And the best ID is a passport. Okay, even if it's canceled and expired, it works because it's picture ID, it's birth, and it's citizenship. Because if you don't have those, when you do a Medicaid application, they say we need picture ID. They go, the person 90 years old hasn't driven in 20 years, right? You get to go get a liquor ID then. You need to get one. You need a picture ID. So it's a pain, to get that for someone who's not able to go and do it. So it's really hard. Yeah.
Assisted living
It's not covered. Assisted living is not covered by Medicaid. There are a few specialized programs, like a lot residents in Manhattan. They accept Medicaid, but there's only one or two. But assisted living is not a Medicaid covered program. Medicaid is home care in your own house or a nursing home. Okay, but that high thing where you're kind of in between assisted living, not covered.
So that's private pay?
That's private pay. You can get a home care aid while you're in the assisted living, but the assisted living bill of $4,000 or $5,000 a month has to be paid by you.
So I would like to ask you something about that consumer-directed.
Oh,
Yeah. Consumer-directed pension.
I think it exists right now. But
What?
Yeah.
I'll explain.
What I'm interested in, if you can hire as a personal assistant provider your son in
Oh,
New York State,
I mean, they just changed it. Okay, the question was consumer.
In the rest of the United States.
The question was, what about consumer directed? The consumer directed program is a program within Medicaid where you can hire your own people. You don't have to just accept what they give you. You can just say, I have Sally who's been looking after me for years. I'm going to hire Sally, put Sally on the payroll, have Medicaid pay them. All right. It's almost vanished right now because they just switched to this HMO program. It's very hard to get consent. I don't even know where it exists right now. It's supposed to exist, but it's really hard. But if it worked, you could go and hire your own person. So now this gentleman took it to the next level and said, well, if you could do consumer direct and hire who you want, can you hire your son? And the original answer is no, but there's something in my mind that recently they did change the rules.
I know someone in Staten Island who's presently planning to be paid to take care of them.
Okay, so I know there was an exception recently
I
passed.
don't know what
It
it's
doesn't
called.
reside in my apartment.
Doesn't have to reside there. It has nothing to do with residing. It depends on if they're a son or a daughter. It used to be had to be more removed than a son or daughter. It'd be like granddaughter or a niece or nephew. Now I think that you'd have to email me. I have to look up the rule. There's a recent ruling about an exception now that someone can closer relative can be paid, but.
How about the stepson of the patient?
That should be all right. Right, that's not a son. You know, the bigger thing is your last name the same or not? They don't know. It's not. If it's different, then who's going to look?
You know, they have their own website.
There's probably some question on the CPAP. You see that CDPAP, Consumer Directed Program, is a website the lady is saying. And there are some rules listed there. Who can do it?
This year, and they were there lobbying.
Yeah, but I remember, in the last year.
Because the HMOs are supposed to be included, not the free Medicaid only. The HMOs is included because they're supposed to give instruction to the clients who are in need of services that they can participate in that.
But you see, there's so many new MLTCs and HMOs, they haven't been taught all this stuff.
Yeah, right. The HMO hasn't been taught, and that's the issue. They said
so CPAP still exists, but it's right now it's in limbo.
Looking at the website, I found different meanings.
Oh, conflict.
Yeah. Let's say
call them.
The so-called financial intermediary says that you are not allowed to have your son hired as a LNA.
I mean,
and there is a rule done I believe in 2011, and they say if the son doesn't live in the apartment, you are allowed to have it. Which is correct one?
Could be both. Could be both. Because you could have a son who's saying, not living there. Okay, but I don't know. It's a very specialized question, and a little bit my head remembers that, but I can't tell you for sure.
Well, in other states you're allowed. I know someone that was doing it for your mom in Virginia, where people, particularly in rural areas, where they can't get
right, you can't get helpers, so they make exceptions.
So they make
right, that's why each state is a little different.
Yes.
Okay.
There is an organization called Self-Help.
Oh no, I used to be the director of Self-Help Legal Services.
They can answer that because they did
you can call in.
Under Medicaid redesign.
Yeah, you can call calling around. You will find the answer. There is an answer to that. Just that I can't.
There's an answer.
Okay, could we have maybe one more question?
Okay, one more question, then you can all go and have snacks. I gotta get home too. I live in New Jersey. So one last question. Any final question? Okay, well, thank you very much. And any questions, you can always call me.
Everyone is signed in. We have the release forms, the evaluation forms, which I hope you have. In addition, there are brochures in the front. Attorney Chu talked about the Alzheimer's Association. If any of you have need of that information, there are pamphlets up at the front table, as well as some brochures from former talks.